Imagine someone at home has been sick for a few days. At first, everyone thinks they understand what is happening. Maybe it is something minor that will settle on its own. Maybe it is just part of recovery. Maybe it is nothing to worry about yet. Maybe it just needs a little more time. So the first response is reasonable. Let us give the medicine time. Let us watch and see. Maybe they are just tired. Maybe tomorrow will be better. But then, the illness begins to feel different. Not because of one single obvious warning sign, but because the overall situation starts gradually shifting. The person is not recovering the way people expected. They are more withdrawn, more difficult to talk to, more exhausted, less able to drink, less able to get up, hard to recognize as the same person. And often, the people closest to them are the first to notice it. They may not know the medical word. They may not know what is happening inside the body, but they know something has shifted. That is when awareness becomes important, because sepsis is not always recognized by one dramatic event. Sometimes it is recognized by the quiet realization, this person is getting worse, not better. And when an infection is followed by that kind of change, it deserves immediate attention. If you are worried that an infection is becoming serious, you need clear, direct questions. You can ask, what infection do you think is causing this? Is this infection affecting the rest of the body? Are the blood pressure and oxygen level okay? Is the person making enough urine? Will the infection causing this need any procedures or be treated with surgery? Can they be treated at this facility? These questions matter. Because treating a serious infection is not always about giving medicines. Sometimes the infection needs a procedure to remove or control its source. Sometimes an infected tube, line, or medical device has to come out. Sometimes a serious problem somewhere in the body needs surgery. So, when someone is very sick from an infection, there are two big questions. First, where is the infection coming from? And second, what treatment does this person need? You are not asking these questions to challenge the healthcare team. You are asking because clear questions can help everyone focus on what matters. So, when should you move quickly? If someone has an infection or may have an infection, pay attention to changes in 5 areas: how they think, how they breathe, how strong they are, how often or how much they are passing urine, and how they look overall. Get urgent medical help if they are confused, acting strange, not making sense, or much harder to wake than usual. Get urgent medical help if they are struggling to catch their breath, or look like breathing is taking too much effort. Get urgent medical help if they are suddenly too weak to stand, too weak to sit up, fainting or passing out, or unable to move like they normally would. Get urgent medical help if they are passing very little urine each time they use the bathroom, or they have not urinated for greater than 12 to 18 hours at a stretch without meaning to hold their urine. Get urgent medical help if they look seriously unwell. That may mean very cold or sweaty skin, very pale skin, patchy looking skin if that is visible, shaking chills, a very fast heartbeat, severe pain, or the person keeps saying, something feels very wrong. Also, pay close attention when someone is getting worse after recently having surgery, giving birth to a child, or having an injury to their body. And be even more careful with babies, older adults, pregnant women, people who recently gave birth, and people who already have serious underlying health problems. In these situations, do not wait for every sign to appear. You do not need to be 100% certain. If the person looks much worse than usual, get help early. And when you arrive for care, say clearly what you are seeing. You can say they have an infection and they are getting worse. Or you can say I am worried this infection is getting worse. You are not trying to diagnose the person yourself. You are helping make sure the concern is heard clearly. That information can help focus attention quickly. Sepsis is frightening, but understanding it is powerful because the goal is not panic. The goal is recognition. An infection should not be ignored when the whole person is changing. Not thinking clearly, not breathing normally, not passing urine, not staying awake, not looking like themselves. Those changes matter. You do not need to be a medical expert to notice that someone is getting worse. You just need to pay attention to the change. So, remember this. Sepsis is when an infection becomes a threat to the whole body. And when an infection starts affecting the whole person, time matters. Do not wait for the situation to become dramatic before speaking up. Ask for help early. Ask clear questions. And if something feels seriously wrong, say it plainly. Could this be sepsis? This is Med-Affairs with Dr. Osa, guiding patients and families to understand what is happening before fear and confusion take over. If this conversation made sepsis clearer for you, share it with someone who cares for a child, a parent, a patient, or anyone who has ever wondered when an infection is becoming more serious. Because sometimes the right information at the right time helps people recognize danger sooner. Until next time.